Welcome to the inaugural episode of the Fraudcast Podcast with the Pennsylvania Senior Medicare Patrol, or PA-SMP. The SMP is a national initiative designed to teach Medicare beneficiaries how to protect themselves against Medicare fraud. Medicare fraud is a real problem. The Office of the Inspector General, or the OIG, estimates that between $60 and $90 billion is lost to fraud annually. Yeah, that's billion with a B, $60 to $90 billion each every year. That translates into higher out-of-pocket costs for Medicare beneficiaries and lower quality of care in the healthcare services they receive from providers. The SMP has a tagline that everybody should remember: protect, detect, and report. I'll talk a little bit more about each of those three components here. Protect. Do not give any personal, financial, or medical information to anybody who you do not know or do not trust. As one of our lovely SMP volunteers is known to say, treat your Medicare number like it is gold. Remember that Medicare and Social Security will never call you, especially not to quote-unquote confirm your information is correct. Scammers often use scare tactics like this to force you into making immediate decisions. Understand that most of these people are out to harm you, they're not out to have a conversation, and you owe them nothing. If you have questions about your healthcare services or what is available to you, please contact your primary care physician. Piece number 2, detect. It's real simple. It's a little bit of a pain, but it's real simple. We ask the folks when they go to see a provider, whether that be a doctor, a pharmacist, even a physical therapist, take a piece of paper with you or a journal. Write down the date of the service, the provider who you saw, and a quick little synopsis or summary of what happened during that visit. If you are a traditional Medicare beneficiary, every 3 months you will receive what's called a Medicare Summary Notice. If you have a Medicare Advantage plan, you will receive what's called an Explanation of Benefits, or an EOB, each time you receive healthcare services. Either way, these are both called billing statements, billing summaries. On the front of those, in big, bold letters, slapped, "This is not a bill." Well, while that may be true, there's very important information on that document. Do not throw it away. Rather, compare it to your own records. We just ask that you take a second to look at your Medicare Summary Notice or Explanation of Benefits, compare it to your records, and see if the dates are correct, the provider names are correct, and if the services that you listed on your records are similar or the same to what you see on your billing statement. Not all discrepancies in your statements are fraudulent. Mistakes can happen. Healthcare billing is really, really complex. Fraud actually is the intentional misrepresentation of a claim to receive a benefit that you're not entitled to. Mistakes aren't exactly that in every circumstance. If you have further questions or if you need support contacting your provider or Medicare to ask about charges on your statements, please give CARIE a call or contact your local SMP. All right, piece number 3, report. Pretty good segue there. I think reporting is if you have any questions, if you think that you have been defrauded or somebody is out to steal your information, please do contact your local SMP. You can also contact local law enforcement, the Federal Trade Commission, or your state's Attorney General. All right, well, we're talking a little bit about fraud, so what exactly can fraud look like in your healthcare as a Medicare beneficiary? There are several different ways that frauds can occur, and they do change over time. There are consistencies that we see historically. For example, double billing for services is fraudulent. Billing for more services than were received. Billing for more services than provided is upcoding that is not allowed. Otherwise, keep an eye out for predatory tactics by marketers on the phone, via text message, or via email. Do not respond to somebody calling, offering you a brace or piece of equipment, such as a back brace, knee brace, walker, wheelchair, diabetic supplies. So there are some issues at play here, and we can talk later in another series about how scams work, but the important piece here is to understand that if you have questions or if you want one of these services that these scammers are offering you, hang up the phone or don't pick it up in the first place and contact your physician. So anyway, In this ever-informative series, we'll share witty and memorable phrases such as slam the scam and shrewd to be rude, and our new one, treat your Medicare number like gold, to teach you how to fight back against Medicare fraud, abuse, and errors. To get us started here, and to provide some more information and a break from my voice, we have two very special guests joining us today who are both on the line right now. They are two PA-SMP volunteer educators, Mr. Mike Ebner and Miss Jacqueline Jefferson. I'd like to welcome them both and encourage you to listen along as we have a conversation about how you can protect yourself from Medicare, our program, and what to look out for. And now joining us on the show is one of our longest tenured volunteer here with the Pennsylvania Senior Medicare Patrol, and a good friend of mine and somebody who I have learned a lot from and had a great deal of experience working with. So I'm very happy to introduce our volunteer, Jacqueline Jefferson. Jacqueline, welcome to the show.
Glad to be here.
Yeah, wonderful. All right, let's get right into it here. I as I mentioned there in my little preamble, Jacqueline, you have been with the program longer than any other volunteer. At this point, looking back on your career as an SMP volunteer, what inspired you to become a volunteer with the program in the first place?
The beginning was the lack of knowledge when I became a Medicare recipient. I knew nothing about healthcare fraud. And the doctors that I knew, they had heard about it. I could not find any information. So I pursued, they had a presentation at the convention center of which CARIE was involved. So I went and I did sign up to volunteer. At that time, it was healthcare fraud. And I took the training. My intentions were simply to learn about healthcare fraud. I had no intentions of being a presenter or anything. And here I am today doing what I didn't start out to do.
Yep, it's funny how life works out that way. And, I think for a lot of folks, coming into Medicare can be extremely confusing, and there's a lot to digest with that process. And I don't think that a lot of people at the front of their minds, I don't think fraud is something that they're considering. So that's a really good point and really, really interesting way to have gotten started with the program. And speaking of getting involved with the program, I want to bring Mike in here real quick and introduce him to the show and get a little bit more information about how he got started with the SMP. Mike, how are you doing today?
Very good. Nice day.
Yeah, beautiful day. Glad to hear it. We actually have some spring weather for once, seeing the sunshine for the first time in about 3 days.
We've had summer, winter, and spring all in 2 weeks.
Yeah, it's been pretty unbelievable. It's great for the allergies.
Yeah.
All right, Mike. Well, again, thank you for joining us. I recognize that you've been a volunteer with the Senior Medicare Patrol for a number of years, so I'm just curious how you got involved with the program.
Well, I've done fraud work almost my whole life. I was a policeman for 23 years, and then I retired from the police department, went to the fraud unit at Progressive Auto Insurance and did auto fraud, which encompassed doctors and lawyers. And then I was there for 7 years, and then I went to Blue Cross in their fraud unit. And that encompassed basically the same thing, but in a larger scale. I interviewed and investigated doctors, pharmacies, members, hospitals, and providers of medical equipment. Did that for 15 years, and then I retired. And then I gave myself a year off, and then I looked into fraud programs and found CARIE and contacted them and sent them my resume. And now I'm a volunteer there for about 6 years.
Excellent. And it sounds like you just couldn't stay away from fraud fighting, Mike.
No.
Yeah,
I hate people that take advantage of other people.
Yeah, that's right. You and I both were in this together, and I think that background in fraud prevention is really powerful for our program, and definitely important for us having somebody like you with your experience, knowledge, expertise, and passion as part of our program to help spread this message. It's quite obvious, I think, that the SMP volunteer program is not exclusive to any particular background. We have volunteers from all sorts of backgrounds who offer their own expertise in different ways, and that's one of the things that makes our program so effective. Going back to you, Jacqueline, you weren't looking to get into public speaking or speaking with audiences at that time, but through your experience with the program, can you tell us a little bit about some of the experiences that you've had, some of what you've come across out in public teaching other beneficiaries about fraud prevention?
In the very beginning, I found resistance. They don't want to talk about it. And I felt many of the seniors were, as I was, they didn't know, they had no idea of what to expect. And their deepest concerns were losing their medical team if they spoke about anything being wrong. So they resisted. And it was hard in the very beginning to break that or to build their confidence in you that you weren't there for any other purpose but to teach them what medical fraud was about. And I felt in the very beginning, there was resistance and they did not want to hear from me.
Mm-hmm.
But today, they are more receptive, but they don't want to talk about their specific healthcare team. They're reluctant to do that. And doing presentations, you can see on the faces of some of the participants that they have something to say and they hold back. I have found recently of talking to them afterwards and saying, look, if you need help, you can call me and I will take your problems to the specific people if you don't want to do it. But that has not worked either. They rather not talk about their specific problems.
Yeah, and that's a really, really good point. And I've encountered that as well, doing presentations. And I think, you and I have spoken about some strategies with, experiences that we've had and how to combat some of that. And I think it really boils down to, at least in my opinion, the SMP is a program of empowerment. You brought up a really good point that people don't want to engage with their healthcare team to accuse them of something that might be wrong. That could be for a host of reasons. You mentioned, potential retribution from or retaliation really from a provider. Now, it's unlikely that scenario would happen, but a lot of people don't necessarily feel like they have tools or ability or confidence in themselves to address these concerns. Having folks like you, folks like Mike go out and speak to groups and empower them to take action is really, really an important issue. You brought up the fact that you've had conversations with beneficiaries out there and people coming up to you after presentations and whatnot. What are some of the issues that they're addressing? What questions are you getting out there?
Well, their concerns about fraud, I get the feeling that many don't understand it or just they don't believe it.
Yeah.
They think it's one or the other. And I try to consider it when you talk to them specifically. I know one case was identity theft.
Mm-hmm.
And this particular participant, I swore that I wouldn't say it, but she had given her Medicare card to her friend.
Mm-hmm.
And I told her that was illegal.
Mm-hmm.
And she said, well, she didn't have any money as she was sick. I said, that's understandable, but you were wrong and you could get in trouble. And that was my first experience of realizing that identity that they were passing on or selling their Medicare cards. I had no knowledge of that until this happened to me. Mm-hmm. That's when I realized the extent of what this was really about.
Excellent. Yeah, thank you, Jacqueline. The extent of fraud in the Medicare system is really huge, and it does go from top to bottom and bottom to top with beneficiaries, scammers, and it's all over the place. And with that, Mike, I'm wondering, outside of your professional realm, or even if you want to talk a little bit about some sanitized casework that you may have you had any personal experiences with fraud that you would like to share to help people understand a little bit more about how this works?
Well, yeah, I personally, nobody's tried to commit a fraud on me, but my wife, she got a letter in the mail from a collection agency saying we owed about $300 for a procedure that she had done. And it was really, the letter looked professional, the date, the time, the location was all accurate, but the timing that we got it was only about 3 weeks after she visited the doctor. So I knew right away that something's wrong here. So then I contacted the hospital and they said, no, there's no way we would send a collection agency out. I called Medicare. Medicare said it was in a process of being paid. So then based on that, I referred that to my old unit at Blue Cross and sent them a copy of the letter, and they're currently investigating that. But it looks so real. But again, it's the little hints that you get that there's something wrong. It was just too soon to come after a procedure.
Yeah, absolutely. And, I remember you had also referred that to the SMP, because I remember you and I had spoken about that and took a look at that notice. And we both remarked, I think, some of the information on there was indeed correct. And we were wondering how that information would have been divulged, or, how the scammers got that information. But Mike, I think this is an excellent example, because the pathway that you followed there is one of the things that we talk about in our presentations about, as a Medicare beneficiary, you are entitled, you have every right in the world to question your healthcare, and you followed the protocol that we recommend in our detect piece of, contacting the provider, asking some questions, and then contacting Medicare. And following up with Blue Cross was a great idea. Now, what are some of the ways that scammers are targeting folks, and what do you recommend people do to fight back?
Well, they like to offer what we call free stuff. And free stuff is a killer because everybody likes free stuff. And what they'll do, they do it in the malls, they do it by phone calls, they do it by mail. They'll give you a call. Hey, we're from the doctor's office. They might not know your name of your doctor. They'll just say the doctor's office. And we got a little program here. We're reaching out to the people. Do you have a sore back? Oh yeah, I have a sore back. Everybody does. And okay, we can send you out a nice back brace. And we just need your Medicare number. Make sure it's the correct one we have in our system. And there you go. You give them your Medicare number. You may get a back brace in the mail, but it'll be an ace bandage. And that costs about $7. And they'll bill Medicare $900, $1,000, $1,200 for a back brace. So phone calls is the primary way they do it. So again, don't answer the phone. Don't give your information out. If you think it's your doctor's office, say, okay, I'll call you back in a little bit. Call back to your doctor's office. Like I said, the mall, you walk through the mall and there's a nice setup, a couple of people with their white coats on. They give you the high sign. You come over. What do you got? Well, we can give you a fast physical. Sit down. We'll take your blood pressure. We'll look in your eyes, look in your throat, look in your ears, make sure you're okay. Oh, that's okay. No, it's for free. It doesn't cost you anything. That sounds great. You sit down. They do these 3 things. We need your name, your Medicare number. You give them that. They bill Medicare for a complete physical. Now, Medicare people are allowed 1 or 2 physicals a year. So now you go to your doctor's for your regular physical. He gives you the physical. He turns the bill into Medicare. Medicare rejects it because you already had your 1 physical this year. Now you're on you may get a bill from the doctor for a $300-400 physical. So again, stick with your primary care physician. He's what I call, he's the Green Beret of the medical profession. He's the guy you got to be close to. He'll send you to the right people. Again, free stuff. If it's free, it's not, it might be free to you, but it's going to cost Medicare. Medicare spends roughly $80 million a year in fraudulent claims. 80 billion, I'm sorry, B, but a billion. You could build about 160 football stadiums. So yeah, it costs a lot. Everybody has to pay except for the scammers.
Yeah, and again, Mike, of course, given your experience, you touched on several really important topics there, and that 80 billion, it does have real impacts, like you're mentioning. That affects all of us as taxpayers. It affects the healthcare that beneficiaries are able to receive now and in the future. So it is really important to help not only protect yourselves as individuals, but everybody within the system as a whole. Either way, you have the background and knowledge and the information to pick out those little hints. But to that note, for folks who maybe are a little bit less aware of how fraud works, less involved with fraud fighting, what are some of the little tips and tricks they can look out for, whether it be on their statements or some of the fraud scams that they may get in the mail or by phone?
Sure. First off, I did a lot of teaching of fraud to the new people that came into our unit. And the first thing I teach them is when you see something, you hear something, you get a letter, the second time you say, this doesn't make sense. It doesn't make sense. You got to look at it further. Second time you scratch the back of your neck, something's wrong. Your self is telling yourself, self, there's something wrong here. But besides that, the most important thing is to protect your insurance information, because that's what the scammers are looking for. They're looking for that Medicare number. They're looking for your Social Security number, because they really need three things. They need or four things. They need your name, your date of birth, your Medicare number, and maybe your Social Security number. And with that, the scammers can start submitting claims to Medicare that didn't occur. There's lots of things they can do with that information. So like number one is you got to protect your information. Number two is when you get your explanation of benefits in the mail, look at it. Look at it. Don't just because it says this is not a check or it's not a bill, then don't throw it away. Look at the dates. Make sure the dates line up and the treating physician lines up with the dates you went to the doctors. If you don't recognize the date, if you're out for a week on vacation and you come back and a month later you get the explanation of benefits, and here you were seeing a doctor while you were on vacation, but not where you were at, then there's something wrong. CARIE or law enforcement needs to know about that.
I'll focus quickly a little bit on that protect piece. You're imploring folks to protect their information, and you mentioned the four major pieces here: the Medicare number, date of birth, Social Security number. Those are the three that I think about. And then something that you mentioned, Mike, about checking your statements. When you see this is not a bill, that does not mean throw it away. Jacqueline, do you have anything you would like to add here?
Well, they should look at these codes that's on their statements, and they're usually listed on the back. Well, I've been told they don't understand them. And then I refer them back to their healthcare organization if they don't understand them. If not, call CARIE. But they are billed for the doctor. They have the doctor's name. They understand that. Mm-hmm. But then there's other things they're billed for they don't understand. Now, if it's lab, they identify that. I have been concerned that is it because Medicare, as I tell them, decides how much they're going to be billed, how much is going to be charged. I said, a doctor can charge you $500. If Medicare says his service is $50, that's it.
Yep.
So then I have concluded, is this a way of getting more money, adding other things to this doctor's bill? And I've noticed on my own, but see, I call, I don't know what this means. And if you don't take it off or give back the money, I'm calling Medicare. So I know how to do it, but they don't.
Yep.
And I do believe the charges are being based that Medicare is not paying the full amount. And this is a way to get more money, but I can't identify it.
What you just mentioned there, Jacqueline, is something that is very important, and it brings up a point that Mike also addressed: healthcare literacy, or really the lack thereof, especially when it comes to Medicare. I mean, it is incredibly complex. I certainly don't have to tell you that. Brought up that if you see something on your statement that you don't think is correct, you call the provider, and if that provider is not able to assist you, or you escalate that to Medicare, or in certain circumstances, if you need to get the SMP involved, then go ahead and do that. We're happy to help. But Mike, anything else that you have here?
Yes, and another good one again is at the mall. You're walking through the mall and they got the lab coats on. Hey, come on over here. How's your feet today? They sore? Well, stick your feet in this mold here. We'll take an impression of your feet, and then we'll send you some nice inserts for your shoes. And sure enough, 5 minutes later, they got their molds. They're giving out their Medicare information. And a month later, I get a Dr. Sol's insert that cost $8. And then they bill Medicare for special orthopedic inserts that might cost $900. Another thing, it comes in a little bit on DME, but it's the labs. There's been a big problem again with the malls, or even sent at home to have an at-home test to see if you're prone to get cancer. You just swab the inside of your mouth, they send it away, and you'll get a report back. Again, they got all your information again, so they can pass on to other scammers. And then again, they bill Medicare. From what I understand, like $2,300 for a special lab test. It really doesn't work.
Yeah, and that's a really big one right now, the genetic testing scams. And that $2,300 might be per line item. These scammers are pretty sophisticated, and they will bill as many things as they can on one claim. We've seen some reports of claims upwards of $12,000 that Medicare is paying out fraudulently. And I want to get Jacqueline's take here on anything else that she's encountering out in the field.
Another one was about how can they get their doctors to more time and payment. This was a concern about some of the participants. The doctors now spend little time with them, and they don't address all of their issues. And they get the same amount of money for less time. And they wanted to know, how does Medicare deal with that? And these were those who received statements, and they said they get less than 15 minutes. Well, we know they work now under organizations, and the doctors are limited. They have to see X number of patients. So I suggested write your questions down. You might get one answer or two answers and leave it, and hopefully he will contact you. Well, they think this is fraud, that they're being billed for something they're not receiving. And that is questionable.
Yeah.
So it is. You spend 15 minutes, and before you had ample time, the billing, say, was $150 to visit. You're being charged that same amount for 15 minutes.
Yep. And it is troublesome, I think, for a lot of folks, Medicare beneficiaries in particular, because like you mentioned, in the past, that was not the case. There was more time. There's less of a push for providers to see 30 patients in a day. I mean, that's a lot. And I think the healthcare system in and of itself, the fact that it's changed and a lot of people's minds changed in a way that is not conducive to improving beneficiary care, the quality therein, is a major cause for concern, and something that we do field a lot of questions about. Jacqueline, could you talk a little bit more about any personal experiences in that vein, or in other experiences you may have come across with fraud?
Well, my personal one was with two providers. I saw one provider on a specific day because I had given up on other one. I no longer was going to him. And I was billed for services on the same day. So I called the provider that I did not see, and I asked his office, why was I billed?
Mhm.
And they tried to convince me I was there. And I said, no. Then I went to Medicare, and the young lady said to me, you older people don't know where you are half the time.
That's nice.
And that sent my blood pressure sky high. So then I called my supplement, and they told me what to do, how to get a letter from the provider that I really saw and send it to them. Well, they handled it. And the provider I didn't see called me and was very upset because I had taken this through the channel. And I said to him, I said, well, your office tried to convince me I was there. And Medicare charged him 25% for each month he didn't return the payment. And it took him over a year to return the money.
What really struck me there is the comment that the person made about, older adults not knowing where they are half the time, which you and I have had plenty of conversations, Jacqueline, where I don't know where I am half the time. And I'm not even 30, and you're way more on top of things than I am. That's just the sort of ageism that I think older adults encounter and people don't really recognize. But yeah, thank you for sharing that experience. And I think it's a really, really strong example for people and listeners out there to understand that you as a beneficiary have every right in the world to question what happens with your healthcare, and you should if you have questions, especially if you're very confident that a provider is trying to scam you or the Medicare system. So with that, I will turn this over to you, Jacqueline. If you have anything else that you want to add, any questions or comments that you want to add.
My concern, the newcomers to Medicare, and the one that I did at the Lutheran home, they were new to Medicare. They had no knowledge of fraud, what to do, and SMP could educate them about fraud and how to deal with it. I found that people were in the same boat that I had been in with lack of knowledge. Because when they came, they said, oh, we can't stay long. We have something else to do. They were there over an hour after we started to talk about this. And I was able to tell them how to go about finding out things and not being taken advantage of. So that has been a concern of mine recently, how to reach the newcomers to Medicare.
Yeah, absolutely. And those folks are fortunate that they encountered you and that you took the time to speak with them. And that's a really major concern that I have as well, new to Medicare folks, and just the overwhelming amount of information related to Medicare, and then the overwhelming amount of information about fraud. And obviously, if there's that much information that we have to share about fraud, it means there's a lot of fraud happening. It's very confusing. We get a lot of questions about what is legitimate and what is not. So yeah, I really appreciate bringing that up. That's why we have folks like you around, Jacqueline.
Well, I really feel how people feel because I've been there in most parts. I've only had one experience with fraud, but I'm at an advantage. I know what to look for.
Yep.
And I'm sympathetic to those who don't know and the reluctancy that they have about discussing it. I understand that. And for everyone I reach, I'm happy.
Absolutely. You and I both. And it's always interesting when things come full circle like that. At any rate, there will be more conversations to be had, I'm sure. But for now, I will let you go enjoy this sunny day. I know it's never guaranteed we're going to have one of those in Philly. But at any rate, thank you so much, Jacqueline. I really appreciate all the work that you do for the SMP and for taking time out of your day to join me here today. Thank you so much.
Thank you.
Mike, do you have anything else you want to add before I let you go?
Medicare never calls you out of the blue.
Yep.
You get a call and it's from Medicare and you didn't ask them to call you, it's bogus.
Yeah, that's
Hang
darn
up,
right.
hang up,
Yep.
hang up.
Hang up the phone. Medicare will
Yeah.
not call you. Likewise
Yeah.
for Social Security.
Yeah. If anything, you might get a letter in the mail for something, but that's once you're 6 months into Medicare, everything runs kind of smooth. They're not going to contact you.
Yeah, absolutely. And that's really important to remember. So thank you for bringing that up. Thank you for joining me, Mike. I really appreciate it. And have an excellent day.
All right. Thanks, man.
I just want to wrap up by reminding folks, listen to folks like Mike. Remember, Medicare is only going to cover that piece of durable medical equipment, that back brace, once every 5 years. If you are interested in a genetic test to see if you have a predisposition to cancer or cardiac markers, speak to your primary care physician. Otherwise, stay safe and thank you for listening. Thank you for listening to this message by the Pennsylvania Senior Medicare Patrol. For more information, assistance, or to report suspected fraud, please contact CARIE toll-free at 1-800-356-3606 or visit us online at www.carie.org. That's www.carie.org. And remember, help is always free and confidential.